Okay, and here is your stem. Wait, who would help him? Can I request someone to help him? Dr. Rana or Dr. Ali Hayat, can anyone please volunteer to help Dr. Ahmed?
Okay.
Thank you. This is your yesterday's station, right? Thanks. So, yes.
Okay, I am ready, ma'am.
Okay, so if you've read and understood, considering it history taking station, please begin.
Hello, I am Dr. Ahmed Aoud, one of the surgical doctor here. Can I confirm your name and age, please?
Hi, I'm Sarah, 68 years old.
Nice to meet Sarah. I have believed that you are in my clinic for a pre-operative assessment and to ask you some question regarding your fitness for surgery. At first, can I know which hip you will do replacement for it, right or left?
Left.
Okay, regarding how's the pain in the left hip right now? Can you tell me more? Yeah.
It's severe pain. I can't walk like before.
Oh, I am sorry to hear that. Since when this pain started?
Since 6 years ago,
Okay,
but
since
now it's
6 years.
worse.
Oh, I'm sorry for that. Can you tell me the pain score? If you, I said to you the pain is from 0 to 10. 0, there is no pain. 10 is very severe pain. How much you will give this pain?
7.
Oh, it's must be frustrating. Okay, is it affecting your life?
Yes,
Okay, and how many meter you can walk without pain?
just a few steps and I stop from pain.
And you using a walking aid?
Yes.
Okay. Okay, now I want to ask you about some medical condition you have. You have diabetes?
Yes, and I take insulin for it.
Since when you take this one?
10 years.
10 year. Oh, and you take the blood sugar routinely, daily?
Yes.
How much your normal?
I
Okay,
100.
can you 100? Okay, so it is controlled.
Yes.
Okay, regarding do you have high blood pressure or what's called hypertension?
Yes, I have.
Since when?
20 years.
20 years. And what you are taking for it?
I don't remember name of drug, but you just 10 or 5 milligram.
Okay, okay. Can you tell me if you have any chest pain right now?
No.
Okay, or shortness of breath?
Sometimes I have asthma, so I
Asthma. Since when you have asthma?
10 years ago.
Okay, and what you are taking for it?
Some inhaler I don't know, but it contains steroid.
Okay, can you tell me what's the dose of the steroid? The inhaler contains steroid, but not tablet, right?
No.
Okay, can you tell me if you have yeah, you said you don't you have any heart disease?
Yes, I have some problem with my heart. I doing surgery for my heart from 5 years ago.
What is that surgery?
I can't remember the name, but they bought something like stent or something like that.
5 years, huh?
Yes.
Okay, can you tell me if you have something what's called myocardial infarction before?
Yes, from 5 years to
5 years. The last one is 5 years, no recent one.
yes, yes.
Okay, and what you are taking for blood thinner?
I take warfarin,
How much? The dose?
5 milligram
Since when you take?
since I do the surgery from 4 years.
Okay, can you tell me if you have any anesthesia problem during the surgery, last
No,
surgery?
no,
Do you have any other medical condition that I didn't mention?
no, I don't have.
Any thyroid disease?
No,
Okay, do you have other surgery than than this one for the heart?
no,
Okay, can you tell me, do you have any leg pain or swelling?
no.
And how many meter you can walk without shortness of breath?
Mm, not. I can't. No, but there is not just a few steps.
Few steps. And how many stairs you can going up without shortness of breath or chest pain?
3 or 4.
Okay. Okay, can you tell me if you have any other drugs you take for other
No,
other medication you have take other than this which you mentioned
no,
for
that's
me?
it. Just that.
Any allergy for any medication?
No, no.
Okay, do you have any family history of medical illnesses?
Yes, my father just died in young age due to heart problem.
Okay, can you tell me can I ask you some personal question?
Okay.
What's your job?
I don't work. I just in home.
Okay, can you please summarize your history now?
Okay. Today I have take a preoperative assessment history from Sarah. She is 68 years old, female, patient obese, planned for total hip replacement left side. The patient is on known case of diabetes on insulin since 10 years ago and controlled. Also, the patient have hypertension since 10 years ago, but she didn't remember the medication. Also, the patient have asthma since 10 years ago on inhaler steroid. The patient have taking a warfarin for the heart problem, 5 milligram, since 4 years ago. She has have no history uh, of anesthesia complication before or any drug allergy. Also, to complete my history, I should ask the patient about systemic review, respiratory and gastro, GIT, also urinary tract system. Uh, uh, for regarding the patient have myocardial infarction 5 years ago. She underwent stent. Uh, for me, the patient need further assessment.
Okay, so what investigations would you ask for in order to confirm your provisional diagnosis?
At first, I should do a full history and examination. Also, I should do CBC, kidney function, electrolyte, the thyroid function test, hemoglobin A1C. Also, to do a pulmonary function test. Also, chest X-ray, ECG, cardiac enzyme,
Okay, and
and yeah, and spinal X-ray and pelvis X-ray.
okay, right. What else would you suggest, or how
I
should
suggest the
this?
patient to be reviewed by endocrinologist
Yes.
and by cardiologist, also by respiratory clinic
Yes.
for her asthma, and to hold the warfarin 5 days before the surgery, and
Yes.
put on the bridging heparin before the surgery.
Right.
Also, I should contact her GP to see the baseline of this patient.
Okay. You were also asking about the patient's lower limbs. Were they swelled or not?
There is no swelling or pain in her
Yes.
lower limbs.
So
Yeah.
there's no further management needed for that. Okay. Did you ask the patient about the idea, concern, and expectation?
Oh, I didn't
Yes,
have
but
the
this,
time, but I should
yes,
know the systemic review and the ICE history.
yes, in order to complete your history. Right. Has patient ever had any previous episode of delirium or dementia?
I didn't
This
ask her.
needs to be, yes, this needs to be also ruled out by contacting close relatives and or the GP of the patient.
Yeah, but yeah, we can. We should
Yes,
ask
you
the
should.
patient,
Yes,
the GB, her baseline to know because the patient is 68.
yes, good. Thank you.